Kate DNC Aitana from BSN 111G, and today I will be performing the return demonstration of the thorax assessment. So first, we need to review the client's medical records and the doctor's order sheets if available. So prior to conduct of the procedure, first I'm going to review my client's previous medical record if available to identify also the instances of harm, medical histories, and current treatment procedures. So second, determine the scope of the assessment, which include the anterior and posterior thorax and lungs using the IPPA or inspection, palpation, percussion, and auscultation. Then, prepare the necessary equipment to be used so we can avoid stopping during the assessment and for us to conserve time and energy. The equipment included are the skin marker, centimeter ruler, and the stethoscope, and also alcohol. Then after that, perform hand washing to protect myself and the patient from the infection and cross-contamination. Okay, so now we need to greet the client politely and the client's companion if around. So introduce myself and verify the client's identity, and then ask the client what would like to be called during the assessment. Then establish rapport with the client. So good day, Mama. My name is Kate DNC Aitana from BSN 111G, and today I'm going to be your student nurse. So Ma'am, can I see your wristband, please? Please state your complete name and your birthday, please.
My name is Mia Monica Peralta. My birthday is on June 15, 2003.
Okay, thank you. So, how do you want me to call you?
Just call me Mia.
Okay, Mia. So, now I will explain the procedure to the client and how she can participate during the assessment. Then, provide the client the opportunity to clarify or ask or raise any concern. So today, Ma'am, I will doing a thorax assessment, which means I'm going to ask you to stand up and also sit down, take off your shirt, and also palpate or touch your upper extremities. So that would be all right to you?
Yes.
Okay, thank you. So, so do you have any question or clarification before we proceed?
None so far.
Okay. So, assessment setting was assured to be safe, secure, and free from distractions. Then position the client to be seated comfortably. So in women, drape the anterior thorax when it is not being examined. So, is it okay with you, Mia, if I close the door?
Yes.
Then this for us to be safe and also to have some privacy. And for us to avoid distraction from the outside. Okay, thank you. And also adjust the room temperature and or adjust the light. Then adjust the light. Okay. So, Ma'am, I'll be asking you to take off your shirt and wear this patient gown. Please wear this so that you can begin the assessment. So, okay, now we check for the signs of respiratory distress such as nasal flaring, forced sleep breathing, and retractions, or problems with oxygenation. Then observe color of the face, lips, chest, and fingernails. Okay, Ma'am, can I see your hand?
Ay, dali na di ang eyes yun.
Okay. Then palpate the suprasternal notch and note the position of the trachea. So, okay, good. So, Ma'am, are you experiencing any difficulty in breathing? How about shortness of breath? And also any chest pain? Okay, none. Okay, thank you. So, now while the client stood with arms at the sides, Then stood behind the client and observed the position of the scapulae and the shape of configuration of the chest. Can you stand up, please? Okay. So, ma'am, now I'll be asking you to stand up, which I already did. Then, this is for to observe the position of the scapulae, shape, and the configuration of your chest wall. And also your normal curvatures, which are cervical, thoracic, and the lumbar. Inspect the spinal alignment for deformities. Okay. So from a lateral position, observe the three normal curvatures such as cervical, thoracic, and lumbar. Then to assess for lateral deviation of spine or scoliosis, observe the standing client from the rear and have the client bend forward at the waist and observe from behind. So, can you bend for me? Okay, thank you. So this is for me to assess if there are any deviation or abnormal curvature of your spine which you don't have, so you can stand properly and sit down now, ma'am. Thank you. Okay. Then palpate the posterior thorax. Assess the temperature and integrity of all chest skin. So ma'am, I'll be assessing your temperature, which is and the integrity of your chest skin. So just tell me if you feel any pain. I thank you. Palpate all the thorax areas for bulges, tenderness, or abnormal movements, especially for the clients who have respiratory complaints. Then I'll be palpating your thorax area if there are any bulges, tenderness, or abnormal movements. Then palpate the posterior thorax for respiratory exertions. Place the palms of both hands over the lower thorax with your thumbs adjacent to spine and your fingers stretched laterally. I'm going to place both of my palms over the lower thorax with thumbs adjacent to the spine and my fingers stretched laterally. So can you take a deep breath for me, ma'am? Okay. Okay, thank you. Then ask the client to take a deep breath, which I already did. Then palpate the thorax for vocal or tactile fremitus. Then faintly perceptible vibration. Place the palmar surface of your fingertips or the ulnar aspect of your hand or close fist on the posterior thorax, starting near to the apex of the lungs. Then ask the client to repeat such words as blue moon or 1, 2, 3. Then repeat two steps moving your hands sequentially to the base of the lungs. Then start toward the midline at the level of the left scapula over the apex of the left lung and move your hand left to the right, comparing findings bilaterally. Move symmetrically downward and out to the cover of the lateral position of the lungs at the bases. So ma'am, I'm gonna ask you to count 1, 2, 3 whenever you feel my hand to touch your back, okay? 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. Okay, thank you. Compare the fremitus focus on the both lungs between the apex and the base of each lung using either one hand and moving it from the one side of the client to the corresponding area on the other side of using two hands that are placed simultaneously on the corresponding areas of each side of the thorax. Then percuss the posterior thorax. Then ask the client to bend the head and fold the arms toward across the chest. So ma'am, now I'm gonna ask you to bend your head and fold your arms forward across your chest. I'm gonna percuss your intercostal spaces in systematic sequence. So this, then bend your head. Compare one side of the lung with the other. Okay. Then percuss the lateral thorax every few inches, starting at the axilla and working down to the 8th rib. Measure the diaphragmatic exertion. Use a percussion to identify the level of the diaphragm and measure diaphragmatic exertion. Percuss downwards from the above the expected level of the diaphragmatic dullness until dullness is definitely here. So ma'am, I need you to exhale and hold it, please. This is for me to identify the level of your diaphragm and measure your diaphragmatic exertion. Okay, so ma'am, so take a deep breath. Okay, again. I mark the level of the full expiration. Then, had the patient inhale deeply and hold it in. Then percuss downward to the level of dullness for inspiration and mark it. Repeat the process on the other side, then measure the distance between the expiratory and the inspiratory levels of dullness. Then repeat this process on the other side, then measure the distance between the expiratory and expiratory levels of dullness. So ma'am, I'm going to repeat this process on the other side and measure the distance between the expiratory and the inspiratory level of dullness. So ma'am, I need you to exhale again and hold it, please. Inhale. Exhale. Inhale again. Exhale. Inhale. Then I'm going to measure. Auscultate for the breath sound. So place the diaphragm of the stethoscope firmly and directly on the posterior chest wall at the apex of the lung at C7. So, okay ma'am. So I'll be listening for your breath sounds. So I need you now, ma'am. So I'll be listening for your breath sounds. So I need you to inhale and exhale with your mouth open. So, say ma'am, breathe. So, compare the findings of each point with the corresponding point of the opposite side of the thorax. Note the location of the chest wall where adventitious sounds are heard, as well as the location of such sounds within the respiratory cycle. Auscultate voice sounds, then follow the same pattern as above. So, for brocophony, ask the client to repeat the phrase um, 99 while auscultating the chest wall. So, okay, ma'am, I need you to repeat the word 99.
99. 99. 99. 99. 99. 99. 99. 99.
Okay.
Wala ko ang likod to.
Then,
For ego.
for egophomy, ask the client to repeat the letter E while listening over the chest wall. Okay, now I need you to say the word E. E. Okay. E. 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 Then, whisper the pectore loci, and then ask the client to whisper the phrase 1, 2, 3 while auscultating the chest wall. Okay, ma'am, I need you to whisper the phrase 1, 2, 3 for me. Okay?
One, two, three. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3.
Then, assessing the anterior thorax. So, expected breathing patterns such as respiratory rate in rhythm. So, okay, ma'am, I need you to lay down on your back here in the bed. Inspected the costal angle, so the angle formed by the intersection of the costal margins and the angle of which the ribs enter the spine. So, palpate the anterior thorax for tenderness, sensation, surface masses, crepitus. Using your fingers to palpate for tenderness and sensation, start palpating with your hand position over the left clavicle, so over the apex of the left lung, and move your hand left to the right, comparing the finding bilaterally. So, okay, ma'am, I need you to tell me if it hurts anywhere while I palpate your anterior thorax. Then I need you to inhale and exhale deeply, ma'am. So,
Pero ano ito? Di ba ko siya massas if ano?
okay. Then move your hand systematically downward toward the midline of the level of the breast and outward at the base to include the lateral aspect of the lungs. Sa script ko.
Ayaw diin. Sige.
Repeat the sequence in palpating for crepitus and firmitus in the anterior thorax. Palpate the anterior thorax for respiratory exertion. Over. Now, so begin the percussing above the clavicle in the supraclavicular space and proceed downward to the diaphragm. Then compare the lung on the one side to the lung on the other side. Then displace female breast to facilitate percussion of the lungs. Okay, ma'am, I will be percussing your anterior thorax. Then compare the lung on the one side to the lung on the other side. Then displace female breast to facilitate percussion of the lungs. Okay, ma'am, I will be percussing your anterior thorax. Listen at each side of the least one complete respiratory cycle. Then listen for normal breath sounds and adventitious breath sounds follow the systematic ladder pattern. The client to breathe deeply through the mouth in an effort to avoid transmission of sounds that may occur with nasal breathing. So, ma'am, I need you to inhale and exhale deeply through your mouth so we can avoid transmission of sounds that may occur with nasal breathing. Auscultate for the anterior breath sounds, adventitious breath sounds, and voice. Then auscultate the trachea and arterial thorax. So I'm going to place the diaphragm of the stethoscope firmly and directly on the anterior chest wall. Then auscultate from the apices of the lungs slightly above the clavicles to bases of the lungs at the sixth rib. So follow the sequence of the anterior chest auscultation. Ma'am, you can now see. So, ma'am, that we are almost done. I'm going to summarize. So, summarize the information obtained during the working phase and discuss findings to the client. So, discuss to the client possible plans to resolve health concerns if present. So, okay, ma'am. To the sum of everything that we covered, your spine is vertically aligned and straight, and while palpating for your anterior and posterior thorax, your skin is intact and the temperature is uniform with no tenderness or masses. So while I was listening to your breath, your sound, it was also normal, and your breathing pattern is quite rhythmic and effortless respiration. Then basically everything is normal, ma'am. Access for the client's understanding of the plan that needed for further teaching. To provide the client the opportunity to clarify or ask any concern. So, ma'am, do you have any question or clarification?
None so far.
Okay, that's all for today. So, thank you for your cooperation. Then, perform the hand washing
To deter the spread of it.
to deter the spread of microorganisms. Then document the findings in the client record using the printed or electronic forms of checklist supplemented by narrative notes when appropriate. So that's all. Thank you.